welcome to another episode of the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Brian Erickson, the VP and GM of Behavioral Health and Specialty Clinic at Avel eCare. Brian, how are you?
Good. How you doing, Jared? Thanks for having me. I'm really excited to be here.
I'm excited to have you. It's a long time coming because you and I met at the American Telemedicine Conference, and I'm glad we were finally able to do this. First day I met you, um, your booth was already ready to go, but like before the conference even started, it was awesome. Um, and then we did a little short teaser clip at the time, which we put out there, which was cool. And now we get to do the full episode. So let's kick it off with a bang. Love to hear about your background, and then we'll talk about the company and some of the cool things you're doing in behavioral health.
Yeah, sure. A little bit about myself. Been in different realms of healthcare, right? I actually started in the pre-hospital world as a paramedic and flight paramedic for many years, and transitioned into nursing later in my life, and actually was managing the emergency department flight team at a local hospital, and I got an opportunity to start working in telemedicine, where roots grassroots of developing a program for ER in telemedicine. I was back in 2009, and I haven't looked back since. So.
And can you talk us through? Because wasn't there? It was like I think it was either an acquisition or a brand change a while back. Because I remember when I first ran into the booth, I was like, I've seen a lot of this, these talking points, and who was it? It was at the big health system, I think, out in was it South
It
Dakota
is. Yep.
or Dakota? Yeah.
Yep.
Um, can you talk about that relationship too
Yeah, absolutely.
for our listeners?
So, yeah, eCare itself has been around for 29 years. It started with a Catholic health system, Bear Health, out of Sioux Falls, South Dakota, supporting us and growing, and really first started meeting the needs of their system, but really looking at how we can grow and went bigger from there. We did get up to 32 different states doing our services. And at that time, when you have a Catholic institution that is really not for profit, and they have to invest back in the communities, and we were definitely stepping way outside of their communities, that they loved what we were doing. And they said, you know what, you guys have to do this at a bigger scale. We don't want to hold you back anymore. So that's when, beginning of this year, 2022, we relabeled to Avel eCare, and we have the same mission, same visions, and we keep moving forward. So.
And can you give for those that I know you mentioned a little bit in your background, and just quick intro. Can you give us a breakdown of your, I guess, your role specifically, your area of the company specifically, but then also of LE Care as a, as a whole organization? What does that kind of look like?
Sure. So my area really, so for vice president general manager, is over the behavioral health service line, right? So our services can be whether they're ER support, inpatient, or even behavioral health inpatient support is what we focus on. We'll talk a little more about some exciting stuff we are doing outside of that. Also, I do specialty clinic, which is really focused on areas, particularly tribal communities, with IHS and 638 communities, providing access to care that they would not otherwise get. So that's really what my role is. But here at Avel, we have 8 service lines in total. So we also have emergency service line, intensive care service line, pharmacy, senior care, and a hospitalist service, as well as school health.
And one of the main topics you and I wanted to touch base on today, Brian, was this idea of interrupting the current of behavioral health. Can you talk us through what that means, and then some of the ways, I guess, take us from an industry perspective, what that kind of looks like, and then give us the value care perspective.
Yeah, sure. And maybe it's even better to go from the patient perspective, right? So if I come in crisis somewhere, and I may enter in a crisis in a different way. I might go to the ER myself. I might try to find help somewhere on a helpline or whatever it may be. But a lot of times, law enforcement is probably the first contact point I have because of the situation. Law enforcement, we've asked law enforcement to do a lot of things already, but they're not healthcare providers. So by default, they have to bring somebody to the emergency department for safety reasons. So that's really where we're trying to think about how can we be innovative and how can we disrupt some of that, right? Because not everybody has to go to the emergency department. And when we're talking somebody in crisis, and no fault to law enforcement, they do a great job, but they have to put you in handcuffs to put them in your car, right? So, um, could you imagine that if you were in crisis and now you're in handcuffs and like, what in the world's going on here? So we're escalating the situation. So we really want to get ahead of that and um, help meet the patient's needs or individuals' needs at that time, where they're at, wherever they're at.
And in terms of like one of the things we need to continue to see in this space is doing things differently, doing something new. So in terms of behavioral health, what are some of the things you think as an industry we need to do maybe differently, better, newer? And then what are some of the things that you're doing over with your organization?
Yeah, I think as you start, we can go back in history a little bit, and the 1960s, we started to a march to deinstitutionalize uh, mental health patients, right? So we started decreasing access to therapy sessions or hospitalization, I guess. And every year, even including this last year, we've had a decreased number of beds, right? But we also have another competing thing going on where we have workforce issues. We're seeing less and less of psychiatry and social work, and the need keeps arising. So we have to find ways to do things differently because we just can't meet the needs in the bricks and mortar situation. So, and anything we can do to support an outpatient and prevent hospitalization because we have limited access to beds and specialists. So we need to do those types of things.
Now, saw you at the ATA conference. What's on tap for the rest of the year? You have any other events that you're going to be attending? You personally, the company?
Yeah, we actually just came back today, or actually last night, from a wonderful customer forum we have. So we're always looking for innovation, and our whole deal is partnering with the stakeholders to say, okay, what are the pain points, and what can we do to help serve in a different manner, and really collaborative model. What's a little different with Avel eCare is that it's not always like a direct to consumer, or it's really that collaboration with healthcare partners, whether it be a health system or a provider giving them support, and filling in the gaps where they need the help. So that's where we were listening to our customers and say, hey, what is it you need? And we did come out of things like that where we have boarding and emergency departments, and our customers say, hey, can you help us a little more with the boarding part? Can we start doing therapies within the ER and maybe discharge them? Because a lot of times we have places that are waiting a week to get somebody admitted to a location, and it's just not a safe environment. It's not a therapeutic environment for somebody that is needing additional help.
What is one thing as we head into the end of the year? I mean, it's kind of wild, right? But I mean, September's here in a couple of weeks. As we head into the end of the year and go into 2023, in terms of the company, what are you excited about that you can share with us right now?
Well, I think the focus on virtual crisis care, which is our opportunity that we've developed, started in the state of South Dakota, right? We started the pilot program. We moved into 20 different counties, and now we're into 40 of 66 counties in South Dakota. We're running back on law enforcement vehicles. And we've had great success there because 80% of the individuals we see through law enforcement get to stay at home safely. We de-escalate the situation and have a safety plan to make sure there's mean restrictions there. The exciting thing is we are now just launching outside of South Dakota. Uh, Actually, we are implementing in the state of Nevada right now, and we're having discussions with other states to also support their law enforcement in that matter. And not only supporting the law enforcement, by doing so, we're supporting the health systems and just the overall system of behavioral health.
Well, Brian, it was great having you on. I want to have you come on again. Probably get you on a panel at some point too, where you can talk with with some of your peers in the space on a lot of the topics that you care really a lot about. But I'm really excited for what the future of the company holds, and it's really cool to see kind of the evolution from just being eCare to Avel eCare and continuing to grow from there. Anything you want to say to the audience before we wrap up?
Well, I just want to thank you for the opportunity, Jared. We are really excited. a rich history, 29 years, looking at innovative ways and supporting. But really, it's a Val actually in the name itself is a breath of fresh air, is what it means. And it is another, we're taking another inhale here and look at ourselves, and we're going to exhale with our partners and find new ways to do things. And we're going to continue to grow.
I love it. Well, I'm excited to stay in touch, Brian. Let's not wait as long to hop on a call and do one of these again next time. This was fun. Look forward to seeing you at these upcoming conferences, which I'm sure we'll run into each other.
Sounds great. It was nice seeing you again.